Hello friends, welcome back. In this short lesson, we shall just have a look at how we can do acute prescribing for some very common ailments. You'll be surprised to find that even for a very simple ailment, like a person coming to you with boils and abscesses, we have a variety of remedies to suit every different kind of a complaint and every different individual. This particular lesson is about boils and abscesses. The way we go about in homeopathy will be demonstrated in this particular lesson through the help of this decision making chart or flow chart. If the patient presents in the early stages of an abscess or boil forming, just check out if the person is having pain. If it's a mild pain, then you can start off with ferrum phosphoricum. You'll be seeing this remedy is very handy in the later videos and it works on a variety of complaints. However, if the pain is sharp and stabbing, in that case, you could use Heper sulfuricum or Heper or Heper sulf. These are the names you'll be very familiar with by the end of this course, and you'll be using them very frequently as your first line of defense in many situations. Supposing the boils are now well established when the patient comes to you. Is there much pus? If yes, then silica or silesia as we call it is going to be very helpful. If there is not much pus, in that case, just check it out if the area is blue or purple. In that case, we shall be dealing with that in the next slide. Remember one thing, Hipersulf and silica or silesia as we call it are two remedies you will be using for suppurations. There could be suppuration from injuries, they could be from abscesses and boils and so many other applications. They are very powerful remedies and they have a very wide variety of application besides abscesses and boils. Continuing further, if the area is blue and purple, we go to the next slide. We continue from where we left off. Is that area around the abscess or boil purple or blue? If yes, then you can prescribe lachesis. Lachesis is also a very powerful remedy. It has many applications. It is prepared from the snake venom of Lachesis muta or the bushmaster snake of South America. More of that later. It is in fact a remedy you will be using in case of heart emergencies. It's a very powerful cardiac remedy, but more of that later. If the area is not purple or blue, just check out if it is better with cold application. That sign which you see before the word cold, which is a greater than sign or a caret as we call it, that signifies better in homeopathic shorthand. If yes, then apis. Apis is another poison which is derived from the honey bee. Typically, apis boils will be pink in color and they'll be painful. If cold applications do not make you feel better, in that case, the remedy could be belladonna. Belladonna is quite different from apis symptoms in that while apis is pink, belladonna is red. It's a bright red, it is painful, it can be throbbing, and it feels warm in the area around it. So those are the characteristics which will lead you to belladonna. Another important thing in all remedy choices in homeopathy is what makes the symptoms better or worse. Apis is better in open air and they are worse with heat or hot applications. Belladonna is better with a light covering, but it is worse with heat and touch. They will refuse the person to touch anywhere near the boil or abscess. Ferrum phos, and you'll be meeting this remedy quite a lot in the next two lessons, is better with cold application, and they are worse with touch, and they are worse in the night complaints. Heper sulfuricum or heper is better with warmth, and they are worse when it is cool. Lachesis, that poison remedy that I spoke about, is better with warmth. Any warm application will feel better. And they are better after sleep. If they sleep well, they'll feel better when they wake up. Silica, another very powerful remedy, so many uses, but in this particular instance, warmth will make it feel better. And they are worse in the morning or after washing. Now remember, all these better or worse conditions apply to all the symptoms that are covered by the remedy. Apis, for instance, is very useful in case of a urination problem where a person is not able to urinate freely. These symptoms will be better in open air and worse with heat. Like that, everything that is mentioned here, it could be heper, which you could be using for quinsy or tonsillitis. They are better with warm drinks and they are worse with cool. It could be cool room, it could be cool drinks or whatever. These are known as generalities and they provide a very good clue for differentiating between remedies. So friends, thank you very much for your attention. This was just an introduction to acute prescribing. This is a very big section because homeopathy started by showing its magic and wonders in acute prescribing. In the time of Hahnemann, he was able to show and convince people of its efficacy in acute situations, in fevers, in epidemics. Its application to chronic cases came towards the end of Hahnemann's life. It was only during the last 15 years of his life, and he lived a very long life, did he realize its potential for chronic diseases. And mind you, homeopathic remedies are quick acting, especially those derived from plants, plant remedies like belladonna, aconite. Any plant remedy is generally fast acting. So these are just a few guidelines. Of course, homeopathy is a very big subject. Mind you, its principles are very simple, but the practice is not easy. It requires a thorough understanding of principles, a good research into cases, and a very open mind. Once again, thank you very much, and we shall meet in the next lesson that follows. Until then, bye-bye.